If you're applying to UCLA School of Nursing and you still haven't started your supplemental application, this video is for you. Hi everyone, welcome back to my channel, and if you're new here, hi, I'm Alyssa and I'm a UCLA Nursing School alumni that graduated last year in June. Today I'm going to be talking about the UCLA School of Nursing supplemental application, what it includes, how I approached it, and some tips I wish I knew before I applied. I know this process can feel super overwhelming because UCLA Nursing School is also pretty competitive, but I hope this video can clarify some things and make you guys feel a little bit less stressed. Alright, let's get into it. From this point on, I'm going to be checking my laptop, so you're going to see my eyes going everywhere. So, if you're applying to UCLA School of Nursing, there's the regular UC application, and then there's also the nursing supplemental application. In this video, I'm going to be talking about the supplemental application. The supplemental application is basically how the School of Nursing gets to know you more as a person beyond your statistics and your grades, and rather it's a more holistic and focuses a lot on your experiences, motivation for nursing, and also you and your personal growth. The three main components of the nursing supplemental application is your statement of purpose, a resume, this also includes your work or volunteer experiences, and lastly, 2 letter of recommendation forms that your recommenders submit after you finish applying. First off, let's cover the statement of purpose. The statement of purpose is honestly the most important part of your supplemental application, and it's usually around 2 to 3 pages double-spaced. In this essay, they want to understand why you want to be a nurse, why specifically UCLA, and what experiences shaped you into the person you are today. I like to think of this as like an interview from the School of Nursing, since they actually can interview us in person. My biggest advice here is don't just list your experiences, focus on reflection. You're going to be listing your experiences in the resume, so instead talk about why something mattered to you, how it changed you, and what you learned. I would recommend starting with like a personal story, maybe a patient interaction, volunteer experience, or moments that made you realize nursing was right for you, and then try to connect that back to your values and long-term goals. Also, try not to repeat your UC personal insight questions word for word. It's okay if there's some overlap in the themes, but use this essay to show new depth. Another important part of this essay is to tell why UCLA School of Nursing. This is where it helps to do your research. Talk about the program's focus on holistic care, leadership, community engagement, or anything that genuinely resonates with you. Admissions can tell when something is generic, so try to be as specific and honest as possible. For my application, I talked about the multicultural background I have, bilingual abilities, the different clubs I was interested in joining, and specific programs I was drawn to, like the immersion program at UCLA. Now let's move on to the resume portion. For the resume, it doesn't have to be fancy, but it should be clear and well organized. Include things like healthcare or clinical experiences, volunteer work, leadership roles, and jobs or extracurricular activities. I'd recommend adding short descriptions for each experience, especially if it showcases anything like teamwork, communication, or cultural competence. For my application, I talked about my experience as a dental assistant, volunteering at hospitals, and leadership roles at my community college, like starting a new club catered for pre-nursing students. So lastly, let's talk about the letter of recommendation. For your letter of recommendation, choose someone who actually knows you well and not just someone who has a fancy title. Professors, supervisors, or mentors who can speak to your character, work ethic, or potential in nursing are the best choices. Also, make sure to ask early and give them plenty of time. I asked my boss at the dentist I used to work at, and then my honors programs director, since I had experience working very close with her as well. Lastly, here are some general tips I wanted to share. Number 1, start early. This probably takes longer than you think. Number 2, get multiple people read your essay. Number 3, be authentic and not who you think the admissions want you to be. And lastly, number 4, focus on your growth, not perfection. Remember, your story is enough, and you don't have to have the perfect resume to be a strong applicant. Alright, and that covers most of the things I wanted to talk about in this video. I hope this video helped you give you a clear idea of the UCLA School of Nursing supplemental application. If you have any questions, feel free to leave them in the comments and I'll try my best to answer them. And if you're applying this cycle, good luck.